For the past year, if you went to a pharmacy like Shoppers Drug Mart for a COVID-19 test, you could only get one as long as you showed no symptoms of the virus. But earlier this week, the Ontario government announced plans for that to change. Pharmacies across the province will soon be able to test symptomatic people for COVID-19. Some health experts have expressed concerns at the move, saying doing so would put vulnerable shoppers like the elderly at risk. And my next guest agrees. Raywat Deonandan is an epidemiologist at the University of Ottawa. Hi there.
Hi there, how are you?
Okay, why do you think it's too soon for drugstores to be administering COVID-19 tests to people with symptoms?
Well, who goes to drugstores? The elderly, the sick, people going to find remedies for their ailments, so they're already fragile and vulnerable. The last thing they need to do is to be exposed to a potentially fatal disease like COVID. Now, if you're going there for a COVID test, you already have a suspicion that you're infected. You've had an exposure of some kind. If you're going there for a COVID test and you've got symptoms, there's a very good likelihood that you're infected and infectious. So it strikes me as an untoward amount of risk, especially if you haven't got the investments in the infrastructure to keep those two populations separate. So the devil is actually in the details.
Now, when we're talking about the infrastructure, then, are we talking about, for instance, the way that pharmacies are currently constructed, when we're talking about ventilation and so on?
That's a big part of it, yeah. So COVID is airborne. Theresa Tam finally admitted that. We've known that for some time. And with an airborne disease, you need a special kind of environment to contain it. You need good ventilation with a good ventilation filter, a MERV-14 or a HEPA filter. You need N95 masks. You need good distancing. And is there a guarantee that everyone in that room is going to be wearing an N95 mask? Probably not. Is there good ventilation? Who knows? It'd be good if we could do this in a tent in the driveway or something like that. That would be fine. I know it's via appointment, and I know they're doing their best to keep distancing and to avoid the intermingling. But doing your best might not be good enough, especially since the nosocomial rates of infection in hospitals, for example, are actually quite high.
I know there are going to be people who say, okay, well, what's the difference between that and going to the grocery store, which also lacks some of those safety measures? But if I'm understanding what you're saying, it's the point being of the sheer number and likelihood of there being somebody with COVID being in that space, the greater chance of it being the case, that sort of separates it from the grocery store.
Yeah, a grocery store, you get a random selection of people. Some might be infected, some might be infectious. If you're actively courting and inviting symptomatic people who are likely to have been exposed into your environment, well, the odds of being exposed to someone with COVID now just went up substantially.
If I am this, I don't know if this is answerable, but because I'm hearing from people, and I watched the response to your original tweet, as people were saying, I'm not going into Shoppers Drug Mart. I'm taking my business elsewhere. I won't even go there to pick up my prescriptions, etc. I'll find a different way of doing things because of the sense of being at risk if they're going in there. If somebody has gone in who had COVID-19, they take off their mask or whatever is required to get the test done, how close do I have to be, or how long after that person leaves the store am I at risk, from our understanding right now of how COVID-19 spreads?
It's hard to quantify that. It depends on the quality of mask that you're wearing, how close you're standing and how long you're there. It is a function of intensity multiplied by duration. Intensity is how close you were to that person, and duration, of course, is how long you spent there. So I can't give a number to it, but we're looking at, I won't put a number on it, but let's just say if you can reduce those two factors, intensity and duration, you reduce your risk.
Because I know when you're saying it's it's too soon to do the sort of thing at drugstores now, do we have a sense of when it would be the right time?
Yeah, right now I think it's a wrong time because we're in the middle of a wave. Ultimately, when this becomes endemic, it's unavoidable that we'll move testing into these commercial environments to make them more accessible, to make them routine. And that'll be when the caseloads are quite low and we are, quote unquote, living with this disease and most people are vaccinated, et cetera, et cetera, et cetera. We're looking at months from now when we can do that, absent the appropriate investments in infrastructural control that I think would make it safe now.
It is, of course, this is the big news today. Health Canada also approving the Pfizer vaccine for kids aged 5 to 11. And I'm guessing that some of those are going to be administered at pharmacies too. What do you make of the risk for kids?
It's a strange confluence of phenomena, isn't it? The risk for kids is always high because they're unvaccinated and therefore they're likely to be infected. The risk of kids getting seriously sick is probably lower than that of adults, but given that Delta is so hypertransmissible, they are more likely to get it now than they were, say, a year ago. So until they are vaccinated, we have to protect them, and that means not exposing them deliberately to people who are likely infected and symptomatic.
What challenges are you thinking are ahead for getting kids vaccinated? Just separate from the shepherd's dogma or the pharmacy question, but what are you anticipating being some of the challenges ahead for
Well, there are two big ones right away. The first is getting enough doses right away.
Yeah.
Second is overcoming parental anxieties and hesitancies to get sufficient doses into arms so that there is enough immunity in the population for the holidays. That's not going to happen, frankly. We're looking at probably till the end of January before we see something meaningful happening in the population. But the overall challenge will be combating parental hesitancy. So we have to deploy a whole lot of educational campaigns, access to experts, a lot of listening to parents' concerns and answering their questions forthrightly.
When you say we won't see the kind of shift that was required until the end of January, why?
Because I don't think we'll get enough doses, first of all. And second of all, it's going to take a time for the first dose to be administered, wait a couple of weeks, probably 8 weeks if NACI guidelines are to be adhered to, then get the second doses into arms. So we're looking probably at 2 months until we get 2 doses into a lot of people. But the results of having 1 dose into a lot of kids won't be seen for another month at least.
So therefore, the holidays could look like what for a lot of family reunions? Or I guess not could look like, but what precautions should people be keeping in mind? Because I think there is an idea right now, hey, kids are going to be vaccinated. It's all going to be okay.
Well, kids can get 1 dose, which is good. 1 dose is better than no doses. And now that Ontario kids are going home with rapid tests, they can monitor themselves and make sure that if they test positive, they remove themselves from socializing with other people and reduce the risk of transmission that way. And we, as other individuals, can also acquire rapid tests and control our exposures. There are things we can do to make this holiday a safe holiday. And I have every confidence and I'm actually fairly optimistic that these holidays will actually be better than last year's and more sociable.
Raywat, thanks very much for your time today.
Thank you very much.
Raywat Deonandan, epidemiologist at the University of Ottawa.